Hello, everybody, and welcome to our COVID-19 follow-up forum. After a very active session at Flex Day, we got a lot of feedback from folks about having more time to ask questions and to get answers and to have some discussion about COVID-19 related issues. So I'm so glad that so many of you are here. We are recording this, so this will be available for those who cannot come here today live, or for those who want to just rewatch it to get some additional information. I have some information that I'll share in the chat, and also in terms of asking questions, there was a survey that went out, and so everyone was welcome to submit survey questions previously. So we did get a handful of those questions that I'll be sharing today, and hopefully we'll be able to get some answers to those. And if you also have questions during the session, we prefer that you add them to the chat for right now so other people can also see it. And then Elizabeth Cook and I are going to be handling the chat questions and moderating and trying to get answers to all of those. So that's kind of the easiest way to do that, especially with such a large group that may also get larger as we go along. So without any further ado, I'd like to introduce our forum leaders as we had before. Dr. Shauna Bigby, our Director of Student Health Services, and Dr. Robert Sammis, Director of Human Resources. Is there anything that you two would both like to say before we start introducing some questions?
No, just thank you for putting this all together. We appreciate the opportunity to continue our dialogue. I just want to say that Shauna and I, a long time ago, put away our crystal ball. Because every time we think we've got things figured out, it changes. So keep that in mind, that we're talking about what we know as of today. Tomorrow, that might all change.
All right, so without any further ado, let me get to the questions that were submitted in the survey, and then also I'm keeping an eye on the chat as you ask questions there as well. So one of the first questions that we had on the survey is, will staff be required to be vaccinated? I presume when we return to campus.
Right. That's a really good question. Let me just the short answer to it, and then I'll kind of go back a little bit. Right now, all of the vaccines that are available, including the Johnson & Johnson, have been authorized by the FDA under an emergency use authorization. As of such, we cannot require employees or students to be vaccinated. If and when the FDA gives final approval, then we will revisit whether we believe it's in all of our interests to require vaccination. You have seen and will continue to see from the COVID work group a campaign of providing information to everybody on the latest information we have on vaccines. We want to encourage people to get vaccinated, but it's not going to be required as of now.
Okay, the next question on the survey was, what kind of upgrades will be done to the filtration or ventilation systems in buildings, especially buildings such as IS? Ventilation in that building is not adequate and is a concern.
Sure. So, and Shauna, please feel free to chime in too. We are complying with all of the Cal OSHA requirements for airflow in all the buildings that we currently have people occupying, at least partially, and we'll continue to monitor where we have issues. There are recommendations in terms of best practices and then requirements. Right now, the primary requirement is that the airflow be at a certain amount of air that we're displacing, and we're easily able to meet that requirement. Shauna, do you want to add anything to that?
I'll just concur. I saw this question and we sent it to Fred, and so he's validated everything that Dr. Sammis just said.
And if there are additional requirements, then we will definitely meet those. And we are looking, that's one of the things Fred is looking at to make sure that our AC system will meet the standards and where we need to exceed them. But it's mainly an issue of airflow right now from everything I have read and what all the Cal OSHA regulations talk about. We do have, the air is filtered, and we are able to for a lack of a better word, pump the amount of air through the buildings that we need to.
Just kind of a follow-up to that, will there be buildings where we will need to open windows, or if a building has windows, in addition to this already air conditioning kind of thing, is that something that will be required in certain buildings?
So if we look at what the recommendations are as of today, and I say that because as we get closer to a more of a full return to campus, I suspect the protocols and regulations will shift. Right now, if a building has windows, the protocols encourage you to open those windows where appropriate to do so. A lot of our buildings don't have windows, so that's where we have to make sure that the airflow is at the maximum that we can provide and meet or exceed the requirements.
Okay. The next question is, what direction will staff have about how to respond to students, staff, and faculty who refuse to wear masks or face shields on in-campus buildings?
That's a really good question. One that we've been talking about. Again, I anticipate that as we do our phasing in of students and staff back to campus, there will most definitely be, as there is now, a strict mandate on mask wearing and also on distancing. So, and as we get through this and we get to, hopefully to a point where the vaccines are actually creating some herd immunity in the campus, there might be a de-emphasizing of mask wearing. But for right now, and as long as we have that requirement, we will enforce it. So if a student refuses to wear a mask, they won't be permitted into a building. If they refuse to wear it once they're inside, then what we will recommend to faculty is they treat that as any other student discipline matter and contact campus safety and let them handle it.
Mm.
Employees, similarly, they'll be required to wear the mask in their offices.
So if
we want to do this more, we want to do this more as we want to encourage people, right? And I'm hoping that the stigma and some of the issues of mask wearing are waning a little bit, but they're not. We know there are some people who have some oppositions to it. But as a condition to working on campus and being a student on campus, as the regs go right now, you must wear a mask, and that will be enforced.
Okay, thanks. The next question is, when the campus reopens, even in a limited capacity, will non-students be allowed on campus? And will building visitors need to show an ID to enter a building? Will there be a limit to, this is cutting off, but will there be limits to how many people are in a space?
I get the gist of that.
What that is, yeah.
So under the tier structure, it only talks about us returning students and staff for instructional purposes. So that is not a reopening of the campus to the general public. That will be something that we're going to have to message, though, because as the campus looks more and more open, I think the public will have some level of expectation that it may be open for them as well. It won't be, and until we're fully open and back to where we were pre-pandemic, I don't anticipate us being open to the public or to visitors, unless the visitor has some connection to an instructional program. Shauna, do you see anything different there? You're muted.
Oh, sorry. You're in regards to
the public coming on campus.
The public, no, I don't see. And like you said, unless we're open to, I don't know how you can keep it private when we're open for school. But for now, as long as we're monitoring entrance and exit from campus, I can't see any of that happening.
I mean, one of the biggest challenges we're going to have once we start getting to the orange level, where we can have 50% of our students on campus, it's going to be difficult to control the ingress and egress points for our students, and how we do that to make sure that we're doing symptom checks, and how we are then getting people to go from a parking lot to a building, from this building to that building, is going to be a little bit of a logistical nightmare. If we had to put the general public population into that, they would be really too much to handle, I think.
So is there ID checking in terms of like the library, for example, or student services that are larger buildings that are kind of open to all kinds of people coming in and out?
That is a really good point and something we're going to have to discuss. I think in order to download the app on My Citrus mobile, I think there is a check to make sure that person is a student or an employee. That's going to be our primary point of reference for doing the symptom checks, is the students and staff will be using the app and showing their pass. And I'm hoping, and I'll double check, Sarah, because that's a good question, if that will ensure the student is actually a registered student.
There's just a couple more questions and then we'll definitely get to the ones that are being added to the chat. So thank you very much for adding your questions to the chat. I see them there. We'll get to those. The next question is, if I don't choose to get the vaccine, will I have to come back to work on campus? What accommodations will be made for me to protect me from the other staff who are vaccinated?
So right now, we are only bringing onto campus faculty and staff who have been designated as essential employees. So for faculty, that has been the ones involved in our health sciences labs, automotive labs, and fairly soon some athletic instructors, as well as some activity and performing arts. On the employee side, we have a memorandum of understanding with CSCA that delineates the areas in which we can bring classified staff on the campus designated as ongoing essential employees. So right now, that is the plan we have. That designation of areas in which people may be designated as essential employees may begin to grow as we do a soft reopening of the campus based on the tier structure. But all of the practices that we know are best practices and in the protocols from the county and the state will be strictly adhered to. So it will be social distancing, it will be wearing of masks, it will be hand washing. The issue of the vaccine, as I said earlier, is kind of a secondary issue right now. We don't require those who are currently on campus in our limited areas to be vaccinated, and there is no discussion of doing that, but we do require everyone to follow all the hygiene, distancing, and masking requirements.
Okay, thanks. The pandemic has highlighted that life doesn't always operate on a Monday through Friday 9 to 5 schedule. We also have seen that the telecommuting works and potentially has some benefits. And for some reason, the thing I'm reading like cuts off. So there's probably a few other words.
Okay.
Forgive me, but I think you get the idea.
Yeah, I mean, I think one of the things that this pandemic, and you could debate whether it's positive or negative, has shown us that we can run certain aspects of the campus remotely. It will be a slow return of staff and faculty to campus. No one's just going to turn on the light switch and everyone's running back. There may be some areas where they have shown that they can efficiently work remotely. That will be part of the latter groups to come back. There may be some areas like techs where we do talk about having a certain amount of the workforce continuing on a limited basis working remotely. Those are things to kind of actually look at, post-pandemic return. Right now, I think all of our effort has to be in how do we do this methodically so we keep everyone's health and safety at the forefront as we start returning students and programs to campus. Then we can start taking a look at what category of employees might be able to continue to do some remote working.
Okay, that was the comments that were submitted through the form. So I'm going to go to the chat questions here. Terry is asking, what do we plan to tell students about course offerings in the fall prior to registration? And then he also adds, the K-12 schools in the LA Unified are facilitating inoculations for their employees. Is there a plan to set up a program at Citrus for employees? But I guess first, what do we plan to tell students about fall?
Right. So I know there is a communication being developed that will go out fairly soon to students, advising them that summer and fall will predominantly be remote. If you take a look at the outline of reopening plan, which we're going to get posted to the webpage hopefully very soon, where I've asked external relations to kind of put it together in a nicer format so it'll look good on the website. But under that plan, as we phase in programs, that's how it's going to be done. So we're not going to be back to normal by fall in terms of lecture classes and science labs, but we are hopefully going to have some more CTE programs back on campus. Everything that we have in our plan is tied to the state tier system. As you may know, that tier system is being modified a little bit right now because the state is saying they're going to lower the standards to move from purple to red based upon the number of vaccines that a county has delivered within zip codes of areas that are defined as economically disadvantaged. So that may very well accelerate the movement in LA County from purple to red. At red tier in our plan, we will look at some additional CTE programs to start returning. The earliest that would happen would be summer. And then we'll look at more numbers in those same programs for fall if we remain at red. If we move to orange, then we'll start looking at winter and spring. It takes time to plan these things in advance. And there are a lot of things we need to put in place once we get to the orange and then yellow level. What was the second part, Sarah?
That was about getting inoculations, or LA Unified is inoculating their employees.
Okay.
I can take the second
part
go
of
ahead,
the question. Shauna, please.
So from a healthcare perspective, there are a lot of regulations that are involved with becoming a vaccination site, from manpower to generators to proper storage, to having emergency staff in the event of adverse reactions. You have to have a computer database, and you have to be able to enter it fast. And right now it's not something that the health center can accommodate. And so I'm going to be sending out places where you can have opportunities to become vaccinated. But I think the real problem still with LA County, if you're in this area, is it's not where, it's the amount, the appointments, and the amount of vaccine available. So I think when this Johnson & Johnson comes out, I think you'll see a lot more openings in your area to become vaccinated. I think that this one and done vaccine will be a big game changer in getting people vaccinated.
The county and the state are emphasizing and giving priority to K through 12 teachers and staff to be vaccinated. So when you go on myturn.cal.gov, which is the primary website to get an appointment, you'll notice a blue dialog box that says, ask for your access code. That's what that is. K through 12 districts have an access code that will give them additional sites to go to. So we're hoping that, people in other counties have had more success as education workers. We just encourage everyone to continue to go. If you're in LA County or whatever, continue to go to myturn.cal.gov and get an appointment.
I know that some people have Kaiser and some people don't, but I know that Kaiser is making appointments available even if you're not a Kaiser member. And so I think that was something that Elizabeth might be able to add to the chat as well, is someone had helped me to dig into the website of Kaiser to actually find where you can get an appointment. And they have an agreement with other insurance companies, so there's an accommodation for that, but that information is there, as well as the My Turn website. So thanks, Elizabeth.
And Kaiser, and thank you for mentioning Kaiser, because they do have their own process. Right now, the last time I checked, which was a couple of days ago, they are vaccinating 65 and older and education workers with an access code. They're not doing beyond that right now. And again, everything isn't that people don't want to vaccinate the other groups. It's all just a supply issue. And as Shauna said, we're hoping that supply issue is going to change pretty dramatically in the next few months.
As far as I'm aware, the screening aspect of this Kaiser website does allow for educators, and that's where I got my appointment.
Yeah, you're right. I think,
and it's not K through 12. It does have the college portion.
Right, but they're not there yet in terms of, that might have changed. I mean, it changes every day. So if you, just encourage people to go to the Kaiser webpage and check. Kaiser, myturn.cal.gov.
Sounds good. All right, we have some other questions here. And also, if there's a portion of this question, if this is your question, feel free to add, comment on it, or if you want any follow-up to it, feel free to throw that in there too. I'll try to catch those. I didn't see anything else that was related to that one. Anna is asking about, she says, my students have started hearing rumors. I think there's several chat comments about rumors, so it's a good theme here. That Citrus College will continue to teach remotely in the fall. And when will the administration make that official? You talked about that a little bit, but is there any time where you're going to make that more official to students?
It will be fairly soon.
Because I can jump in. Hello, folks.
Sure, Dr.
Being here, and thanks, Robert, Shauna, and Sarah for coordinating this. We already have prepared memos to the students in the college community. We were ready to release them last week, but then we were basically looking at some direction that was coming from the state and the county that looked like it was changing rather fast. And also, we realized that our memos were quite early in comparison to last time we released them, to say that there was a college update and the schedule was not posted as of yet. So we basically are coordinating with academic affairs to ensure the schedule is ready. And as well, student services was working on different support services they wanted to include in the memos. So they will be out shortly, but we didn't want to preempt changes from the county, where we basically have to then walk back what we've said and we have more latitude. So we have some sense that, there may be a forthcoming change in terms of where we stand with the tiers. So we're holding off just a bit. And we're still basically early at this point. And I've been coordinating it with external relations as well. Melissa's on the call and she tracks everything as well in terms of timing. And we also track all the other districts around us in terms of their announcements. We were concerned that if we just said flat out that the college is, continuing online remote, that we would have some students pretty much discouraged. So we wanted to wait and see what the real numbers are in terms of how much will be online and how much will be back on campus. So coordinating with, and I'm basically working with Dr. Sammis and Shauna in terms of they're in contact with the county. And I have to thank Shauna again and again, because she's always following up with the county for us. And we do participate in the county calls where they fill us in, college presidents and folks in charge of COVID. And those calls are every several weeks, where we'll get a heads up in terms of what's coming down the line and what changes we can anticipate.
So, if you look at, when you look at the outline for reopening plan, it is all, as I said earlier, tied to the state tier system. It is once we get to level yellow that you start seeing a return of classrooms and science labs. And even there, it is still limited to 50% capacity. So, I think it's probably a good idea for us to kind of conceptualize that summer and fall are going to be real transitions terms for us, where we're going to start reintroducing programs as we can, winter as well, and then spring. I'm hopeful that by spring, we're going to look more like our regular college campus than we have in a long time, but it's going to be in phases.
All right, thanks.
Unless everything just changes and everything goes away and we're told open, which not likely, but could happen.
It happens in other places, as we know, but probably not
We're
here.
not Texas.
No. All right. Jody has a info news flash. She saw on the bookstore website that the Citrus College logo masks are for sale. So that sounds exciting. So take advantage of that. I think a lot of us got one in the mail as well. So that was wonderful. Another question about rumors, and maybe this ties in a little bit to what you've addressed. Rumors about fall sports like football are slated to begin again soon. If so, how can we justify allowing a contact sport like football to be run, yet prevent other activities like academic labs from continuing face-to-face in the fall, especially if those who might be vaccinated?
Right. Really good question. And athletics has been one of those areas where we've all struggled with in terms of planning. Right now, we cannot have competition in our athletic programs, and we have opted out from the conference for spring. We are going to be returning some of our athletic programs to students on campus sometime in early April to start conditioning. That's not an opening to competition. But you probably saw in the news what happened yesterday and today, where the state is opening up high school athletics. And that was as a result of a lawsuit brought by someone or a group down in San Diego. So they're basically redefining the rules and allowing a larger community spread figure in a county as a threshold for opening high school sports. We don't have any clear indication yet that that's going to change, but if we start dropping into the red tier, we will more than likely start getting information from the state that we're clear to begin competition in some of our athletic programs. And then it will be an analysis of which programs and what will be the requirements. We're not going to return any program, athletics or otherwise, without following to the strictest sense the safety and health protocols to make sure that we're protecting students the best we can.
All right, let's see what else we've got going on here. Also, Anna was saying, what if wearing a mask is an impediment to teaching? Will we be allowed to teach remotely? For instance, it would be quite challenging teaching foreign languages with a mask covering your face, and students would be better served with remote instruction where students can actually see our faces.
Yeah, so if we can, if it's just pedagogically not sound, then we have to take a look at that. There are options to a mask that the county regulations will allow. They will allow a face shield as long as it has a cloth covering at the bottom that keeps air from coming out the bottom, I mean, being spewed out from the bottom, not the air can't come out. Shauna, is that your recollection too?
Yes, and I would just say, as we move closer to the tiers for reopening, things continue to change, and I think that's something we should just discuss. I have some notes for our group to talk about, to discuss. I just would want to stay away from giving a hard answer to that, because there's also the movable shields that we can use.
Right.
It's just, I think it'll depend on the space that we're in at that time. Yeah. To give you a hard answer, Anna, that's all.
And then Anna, keep in mind too that based on our current schedule, by the time we start looking at opening up those types of classes, we're going to be in less restrictive tiers. So our ability to do things creative beyond just the instructor wearing a mask will probably be present. Sarah, thank you for posting. So that is a new update from Kaiser about vaccinating education workers. So that is a good source now for people to go to.
I made my appointment a couple of weeks ago, and it was only through a phone number that someone had given me. It felt super it felt super sleuthy for some reason, but it was the random phone number. But they called me back, and but now they're doing it on the website. So
yeah.
All right. Amanda had a question. Will there be any exceptions made for masks to come off for a limited time at a distance for curriculum that might require it? For example, in the dental program or for a photography class where portrait lighting techniques require access to the face without a mask. So similar to Anna's question.
Yeah. So I mean, go ahead, Shauna.
I was going to say, I think it's still too soon to say, because currently in LA County, we do have a mask mandate.
Right.
So it's that crystal ball theory. Yeah.
So the only time that you're permitted to take your mask off inside a work location is if you are away from everyone and you're eating, or if you are in your own office that's sealed off from everybody. But right now, under our local protocols, we require mask wearing at all times, even in your office. So that's something we'll look at based upon, when we're returning and where we are with the protocols. As I said earlier, I suspect that in the next few months, we're going to get a whole new set of rules.
Yeah, it's definitely a constantly, what do they call that? Like a constantly moving
Target, yeah.
Yeah, it's a moving target, exactly. Tina had a comment about the vaccines. You can also register at individual pharmacies, CVS, Walgreens, Rite Aid. They say 65 plus, but stop in and inquire. And she was able to get one through the county site, My Turn. And Elizabeth may have this link as well, but someone in our library crew shared a link about some different tools that people could use to get alerts about when certain pharmacies had appointments available. There were some like browser extensions and some fancy stuff that I haven't attempted to use, but if you want to try something like that, that is also, I think, a link.
And I think that with each of the Rite Aid and CVS, you get directed to their webpage, and then you can also sign up for notices that way too.
Mm-hmm. Okay, we have some websites here. And then Terry was mentioning My Turn tends to release appointments on Saturday afternoons, but they did it on a Sunday morning this past week. So maybe there could be a pattern of when the new appointments are being released as they get new shipments to them. Elizabeth was mentioning she has a Kaiser appointment as well. And
wonderful.
Yeah, Marianne also has one at Kaiser, and that they're doing educators. And Kathy also had that similar issue. I know that those folks who live in San Bernardino also got a little bit of the head of the game on the educators. I have some friends as well that got that earlier this month. New appointments came in around 2:00 on Friday for the San Bernardino folks, maybe trying again later. Tina also had a website that she mentioned. And Anna was also asking, when do we anticipate the announcement? Oh, I think Elizabeth answered that. Let's see what else. Oh, there's also clear masks, which I've also seen, and maybe you've seen too, where you can have it sealed, but you can also see through it. I don't know if there's any criteria of what kind of masks. And Andy was asking, is there a scenario where Fall 21 begins remotely, but finishes in person? I understand that if data justifies it, including, dance, for example, may be in person for 16 weeks, math, just an example, might be remote for the same amount of time, but is there a possibility of a mid-semester format switch, specifically in the remote to in-person direction? Good question.
Yes and no. No, I mean, I think a lot of it depends on how the schedule, there are synchronistic classes online and there are asynchronistic classes. It would be hard to transition people midterm, students and staff, back to campus. So I wouldn't want to say that's not a possibility depending upon where we are with the community spread, but I don't know how realistic that is, except for possibly those classes that are identified as synchronistic.
Those are all the questions. There's a couple other little just comments there about where people got their vaccines, but are there any other questions or follow-up to any of the things that were asked?
Yeah, just so everybody knows, I'm on the Kaiser website right now, and they do indicate that they are now at phase 1B, which does include education workers. So that's a good thing.
I'll also add to the chat the COVID response page for the college, and there is a section there on the campus notification to students as well as that made to employees. So the most recent one for employees was March 1st, as you know, but that's where there would be any other updates from. Is that where the task force in general updates are going to be? Because someone had mentioned earlier in the Flex Day workshop that there were going to be more regular updates from that group.
Yeah, so we're trying to decide if it's better to put them there or under the HR COVID-19 on the intranet. So we keep certain information just for employees, but they will be put somewhere on the website. But there will be a bi-weekly email coming out from the COVID work group. And I anticipate that will keep you up to date on where we are in terms of tier, where we are on our reopening plan, and where we are with vaccination information. But as you know, as we just saw now, it changes in a matter of a day, right? So we'll do our best to keep people apprised. If there are major shifts in what's happening vaccination-wise, we won't wait for a bi-weekly. We'll get that out to people like you saw last week. An email came out on vaccines.
I second what Jody was saying. Elizabeth, did you have a comment?
I did. This is more for Dr. Bigby. Well, that's weird. My video just stopped. Cool. Love technology. Anyway, I don't know about the vaccination standby lists that are out there, and I don't want to post a link that's not going to be, useful, but my brother did send me something that he's been using because, he's young and not an educator. Vaxstandby.com. Do you know anything about those? Like what happens if there's extra doses at the end of the day?
I'm not familiar with that website, but I am, and I've heard of people going to their neighborhood CVS and at the end of the day and just asking, do you have any leftover? And they're getting vaccinated that way. But if you can send me that, I will investigate, and then I will compile all of the ones that are in the chat with the list that I have, and we can send something out.
Cool. I will send this to you. Thank you.
Okay.
Any other burning questions or comments or concerns? Well, it looks like we have come to the end of our, oh wait, somebody, what are you saying?
Sorry, I see a question in the chat from Anna. Do we know when non-education population will be able to get a vaccine? I have adults at home, not in education, but need to be vaccinated. That's a really good question because I'm in the same boat.
Yeah, so I mean, everyone's supposed to be following the the state requirements for categories of vaccination. So right now we're at the phase 1B, then it starts opening up after they vaccinate that group, which we are in as educators. But as Shauna, I think, said earlier, with the addition of the Johnson & Johnson vaccine, and what you're hearing from the federal folks like the CDC is they expect by the end of May that the vaccine supply will greatly increase. Once that's happened, I think you'll see a broader grouping of people who are going to get vaccinated. If you're not in one of the categories, or if you're a young person, like, you're 18 years old and you're not an agricultural worker or an essential worker or pre-existing health condition type of issue, I would imagine, Shauna, and you can chime in here, and I'm just going out on a limb to guess, it's going to be probably around June before those folks start getting vaccinated.
What I've seen and read, it's yeah, May and June that vaccines should be available for everyone.
Well, that's hopeful.
Yeah.
Thanks for catching that, Elizabeth. Are there any other questions or comments?
Just know that, we will do our best to make sure that as things develop, as the tier structure changes or our planning changes, that information gets out to everybody.
Yeah, I think that's really important. And I think I probably speak for more than just Jody there about I think just the more that we know what the college is doing and the more that information about what's happening at the college, I think is, even if it's not the definitive answer that we know that things are changing, is always helpful just to have that communication be regular. That's really helpful.
Right.
Well, I hope this was helpful for everybody. I know there's always questions that you think of afterwards. You're welcome to, add them to that survey, and you guys can, they have the live feeding of that. So if there's any other questions, you can contact them directly as well with any follow-up. But yeah, I hope that was helpful. I hope it gave us a little bit more time to, just kind of think through and hear answers and just trying to have that communication line open. All right. Well, have a wonderful weekend, everybody.
Thank you, Sarah.
We'll see you at the next Zoom meeting.
Thank you.
Thank you. Good job.